How long do you have to wait to work out after a hair transplant? I did my fair share of research online about gym after hair transplant. General consensus is that either 21 days or a whole month resting is necessary before starting lifting weights. However, my doctor keeps insisting on 2 months. That's a huge amount of time for me, considering I'd be losing so much muscle mass. Should I go for 1 month? What do doctors think?
Thank you for your question. You submitted your question without a photo, and you seem to be in a situation where you're trying to figure out when is a safe time to work out after a hair transplant. Your doctor apparently is recommending waiting 2 months, while you see that the general consensus is 21 days, and you can be sure that there's going to be some variability in opinions. So I can certainly share with you how I explain to my patients when the right time would be to work out. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm also the founder of Tricostem Hair Regeneration Centers, a system we developed to help non-surgically men and women with genetic pattern hair loss as well as other conditions who come to us from around the world, and it's something we've been doing and really have established a category of intervention for hair loss. It was evolved from hair transplant surgery. So in understanding the question of when is a good time to work out, as a cosmetic surgeon, where I do a lot of procedures, I do a lot of eyelid surgery, I do a lot of facelift surgery, I do a lot of other procedures, injectables and lasers. And when it comes to just some general principles in surgery, the goal is, when you talk about limiting working out, the way I look at it is I generally want to minimize the risk for bleeding. And so when is that risk highest? Well, again, in general terms, regardless of the technique of surgery, the first few days are really the highest risk. And there are several phases of wound healing that are applicable to all surgeries. There's the hemostatic phase, the inflammatory phase, the proliferative phase, and then the wound remodeling phase. Now, that being said, very often my conversations with patients are about what kind of working out. And that can be quite variable because everyone defines working out differently. Now, for example, we have a good number, we're in New York City, and one of the things that's very popular is hot yoga. Now, one of the things about elevating body temperature, putting aside just working out, is something called vasodilation, and that can be an issue. So, and that can be an issue in terms of swelling. So when it comes to, I think, lifting, and you mentioned about losing muscle mass, I can certainly appreciate your concern. Generally speaking, amongst the fitness community, not working out for about 2 weeks, you're not going to really lose that much muscle mass. But when it comes to 2 months, I think it's important to ask your doctor, why is 2 months the reason to not work out? You know, when people get transplants, let's say you do a strip technique. Well, there's suturing in the back of the scalp. Well, once the sutures are removed, unless there's any pulling of the skin, the wound healing is going to be pretty much unaffected by what you do. When you have grafts in place, those grafts are pretty much stable, and therefore once you get past the first week, then essentially it's a matter of just looking at how much of a risk of swelling there is. You know, when patients come to us for hair regeneration, particularly when they've had previous hair transplant surgery, they're often ready to have a speech about not working out. But because we're doing something non-surgical, where we're using acellular matrix and platelet-rich plasma and injecting it under the skin, and we're not really making any kind of open wound, and it's all just entry points with the skin, then basically working out is again something that I discuss, but you can certainly do that a lot sooner than you would with surgery. So that being said, I think that from my practice, from my hair transplant practice, I would say that I would tell patients, like I do with other surgeries, after the first week, it's usually okay to do something light, and then after the second week, use your judgment and work out to the point where you are not going to get yourself to incredibly high levels of exertion or increase your body temperature, blood pressure, heart rate to an extremely high level. But I would say with each subsequent week, it gets safer and safer to be able to get closer to what you normally do. So instead of having a lot of people maybe second guess what your doctor is doing, I think if they don't have a clear justification, if you are somebody who works out with some regularity and you are pretty intuitive about your body, then you can probably just use your judgment once you get beyond, let's say, the 21 days, the 3 weeks, that is generally accepted as a time when you can work out more aggressively. So again, in the context of just surgery alone, in a wide range of surgeries that I do, and with a large group of patients who are very physically active and fit, I think asking anybody not to work out for 2 months would be kind of unreasonable, unless there was a clear justification. You know, there are other body surgeries such as tummy tucks where that's, of course, a very different discussion. But when it comes to hair transplant, I can't see clearly exactly what the justification would be. So I think it's best to have your doctor explain it to you so that you can understand the thinking, and then maybe you'll be able to come to some agreement as to level of working out so that your doctor isn't concerned that you would be doing harm to the outcome of your procedure. So I hope that was helpful. I wish you the best of luck. Thank you for your question.